Time and health are two precious things that we don't recognize and appreciate until they've been exhausted. Assalamualaikum warahmatullahi wabarakatuh. Good morning and greeting to all of us, the honorable jury, as well as an innovative friend that I am proud of. Did you know that maintaining blood sugar level is very important? How important is it to maintain blood sugar level? We will be dissecting our paper through the 5 outline topic below. Diabetes mellitus, or what is often diabetes, is a health problem that is increasingly occurring throughout the world. Diabetes is a disease that occurs when the body cannot produce or use insulin properly, causing high sugar level in the body. Diabetes is a chronic disease of metabolic disorder which is a rapidly growing global problem with an enormous social, health, and economic consequence.
Currently, early detection of diabetes mellitus is crucial in efforts to prevent health complications that are often associated with diabetes. Data from International Diabetes Federation shows that 1 in 12 people in the world suffers from diabetes mellitus, and the first person with diabetes mellitus don't know that they have diabetes mellitus. Patients only know their condition when the disease has been running for a long time, with very obvious complication. If treated too late, this disease can be fatal. The healthcare system currently in place has not resolved this situation at hand. Only 50% of people with diabetes receive a timely diagnosis. There are still many people who are not aware that they have diabetes or do not have access to regular blood sugar tests. Diabetes mellitus can cause serious health complications and in some cases can cause death. Research shows that diabetes mellitus patients have a 2 times higher risk of death compared to the general population. And poor control of blood sugar levels can increase the risk of death in patients with diabetes mellitus. In patients with diabetes mellitus, so that diabetes mellitus is the fifth leading cause of death worldwide with total death of 4.2 million people. Therefore, based on this problem and opportunities that exist, we are from the Indonesian Brawijaya University, which has members Janu Andrean as a team leader and accompanied by the college Sabaskaran, Tri Satrio, M. Raihan Zulfikar, Kaila Andara Dewi, and Benaya Sembiring as members under the guidance of Mrs. Dr. Femiana Gapsari as CMT, proudly presenting GlucoGuard, innovation in early detection of diabetes mellitus to improve the quality of life integrated tools and mobile virtual assistants.
Starting from the background, what is the concrete form of the GlucoGuard app so that it can be an effective solution for the health problems of blood sugar that many people experience today? In relation to this background, we use continuous glucose monitoring and non-invasive glucose monitoring to support the decision-making process, which aims to determine the best choice of several alternatives that can be taken as a solution and monitoring in real time. And as the first implication by using this application, we hope that users can identify their blood sugar health condition and provide information about how important it is to maintain blood sugar level in the body. Also, by using this application, we hope that the death rate due to the problems of lack of accessibility in sugar checkups can decrease. The software used in the development of GlucoGuard is JavaScript, Visual Studio, and Figma. As for the data management, it is processed with the help of the continuous glucose monitoring non-invasive glucose monitoring sensor small tube that is placed under the skin and connected to a monitoring device worn on the patient's body. NIGM data generated by CGM can then be processed and analyzed using various technologies such as algorithm, machine learning, and artificial intelligence. This can help doctors and diabetes mellitus patients monitor and control their blood sugar levels more effectively. For further details regarding the technicalities of our lab application development, you may refer to our extended abstract paper.
The application itself for GlucoGuard have some leading features that are easy to use and useful for the user's experience. First, we have GlucoGuard Chat. This feature is mainly used to communicate, to consult, and to seek solutions with the help of professionals. With this feature, the user can convey their conditions and ask questions to professionals and get the answers they need until the user is satisfied. Next up, we have Tracking Journal. This feature is the archive of GlucoGuard checkups. This feature saves every checkups based on the date of the checkups. The users can also compare the checkups at the time with the date selected on the calendar, so the user can track their blood sugar and carbohydrates intake progress. After that, we have glucose articles. This feature provides a collection of selected and informative journals, articles, and videos related to the topic of diabetes. With this feature, the user can educate themselves with information that provides tips and tricks, diagnosis, treatments, preventions, and so much more. We also have the feature that lay out the user with a map of the user's surrounding and provides information of the nearest hospital. With a single tap on the pin of the hospital, concise information of the selected hospital will pop up for the user's benefit. Last but not the very least, the main feature of GlucoGuard, the checkup feature. With this feature, the user can check their blood sugar with one singular tap, and with the help of machine learning, the user just simply write down what they ate for the day, and the app will connect to a database and automatically count the user's carbohydrate intake.
From the analysis, we can conclude that the healthcare system is now responsive enough, meaning there is an obstacle in which the procedure for diabetes mellitus checkup is a complicated procedure and that causes people to be reluctant to seek treatment. Therefore, results in about 50% of diabetics do not receive proper treatment. Complication from this situation is lack of knowledge from multiple parts, such as lack of awareness about the risk of diabetes, lack of awareness about early detection importance, lack of healthcare access, and complicated administration. Solution for this complication is GlucoGuard, a mobile-based telemedicine platform specifically aimed at blood sugar problems in the body with the hope of improving quality of life. With benefits such as easier access to emergency hotline, simplified procedure for blood sugar healthcare, introducing and facilitating tracking journal to manage blood sugar, curating a database as resource for medical assistance, and educational content for users. To sum up and conclude this presentation, our GlucoGuard application with several features that facilitated blood sugar health processes is expected to relieve blood sugar sufferers at this time, increase the accessibility of checking blood sugar early for those who need it, and increasing public awareness about the importance of maintaining blood sugar levels in the body. And that brings us to the end. We'll finish up by saying thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.